Hello,
Right.
Doctor.
Hello there.
Hi, how are things?
No, not too bad. Now come in there and have a seat. Mr. O'Leary, is it?
Yeah, Frank O'Leary.
Hi Frank, nice to meet you. Dr. Mike O'Callaghan is my name. I'm one of the
Great.
doctors here.
Thanks for seeing me.
Not at all. So tell me, Frank, what brings you in today?
I suppose I just wanted to come in because my father passed away about a
Okay.
month ago.
Sorry to hear that.
Oh, you're very kind. He'd been unwell for a while, so
Okay.
it's not so much related to that. It's more that he had prostate cancer. Now, he had a few things wrong with him, bless him, but one of them was prostate cancer, and he was diagnosed with that in his 60s. And I myself, I only turned 60 last year, so obviously I'm a little bit concerned what with him having had it, that I might have prostate cancer. So I just wanted to come in and get that blood test to just check whether or not I have it, I suppose.
Okay, I see. Well, as I say, Frank, sorry to hear about your dad.
Oh, thank you.
When did he pass away? Tell me.
Yeah, about a month ago.
Right.
He'd been unwell for a while,
Mhm.
and he'd been in a nursing home and didn't have a great quality of life. He's probably better off, to be honest with you.
Okay.
But it's kind of just probably triggered these thoughts in my head, and that's
I
what's
see.
brought me in today.
I get you. And just from the prostate side of things, and your dad, as you said, he had multiple things going on by the sounds.
Yeah.
Was that a major issue for him? How did that come about? How did it get detected? All that kind of stuff?
Well, as I said, he was diagnosed in his 60s, so I'm not too sure what brought him to the doctor, but
Mhm.
I know at the time that he was in good health. He didn't have anything particularly wrong with him, and he ended up getting some tests done, and he found out he had the prostate problem, and then he had to get a procedure done down the line because it was the cancer was quite big, and then he had some complications from that. And then, I suppose as he got older, he had a few other health issues as well.
Okay, I see. So I suppose I'm kind of building up a picture here, Frank. Could I just ask then, as I say, I mean, you mentioned the prostate blood test, so we'll certainly talk about that in a moment. Just in terms of the whole prostate issue, I do have some other questions for you.
Okay, yeah, fire ahead.
Just regarding symptoms
Okay.
that people might have if their prostate is giving them problems. And most of them actually are involved the going for a wee,
Oh,
kind of
okay,
things. So
okay.
have you noticed any problems going for a wee recently?
No, I mean, I haven't been thinking about it, but nothing stands out anyway.
Okay. And specifically, have you noticed any problems with the stream when you go for a wee?
No,
Like a weak stream or a poor stream or anything like that?
no, nothing. It's as it was,
As
all my life, really.
Okay. Sometimes as well, hesitancy. So it's difficult to start going,
No, nothing
No.
like that.
and at the end, then that there might be some dribbling. That'd be wouldn't be a
No, not for me anyway. No,
Okay. Any problems with erections or anything like that?
no
No.
problems with those.
Okay. And in terms of nighttime, then, any problems having to get up and go to the loo more often?
I'd probably get up the odd time if I'd had a lot to drink, or I'd been out in the pub or something like that.
Right.
But generally speaking, no, I'd sleep through the night, and then I'd usually go in the morning.
Okay. And finally, then, any blood in the urine?
No, thankfully not.
No, you never noticed that. Okay. Because those are just important things
Okay.
that we need to talk about. So I guess, Frank, as I said, I'm trying to build up the picture here. It sounds like, as you said, unfortunately because of your father's history and you're worried about this,
Yeah, I am.
You don't really have many of the symptoms there that we
Okay,
kind of check for the
okay.
prostate. So
That's good,
that's
I
actually
suppose.
reassuring.
Okay, great.
But at the same time, as you said, to talk about the blood test, I think would be best next. So just tell me a little bit about what you know about that blood test.
Well, as far as I'm aware, I would get a blood test taken, and that goes to the lab, and they check for some kind of hormone. And if the hormone is high, then I definitely have prostate cancer. But if it's low, or if it's not there, I think, then I don't have prostate cancer.
Okay, I see. So certainly, yeah, there is absolutely a prostate blood test. It's called the PSA, prostate specific antigen, and it is useful for use in cancer and detecting cancer and in the prostate. So basically what it is that it's a protein.
Okay.
So it's a marker in the blood, as you say, and it can be elevated in some cases of prostate cancer, but
Okay.
not all.
Oh, okay.
And it can also be elevated in conditions that aren't cancer. So
Really?
it's not kind of black and white, It's
Okay.
not that if it's normal, you don't have to worry about the
Oh,
prostate or
okay.
keep an eye on anything, It's not, what would you say, the whole picture.
Okay, so it's not as black and white as I thought, maybe.
No, it's not.
Okay.
And as I said, it's important to consider the other kind of things
Yeah, of
maybe
course.
that could lead to an increased level of that blood
Okay.
test. And I suppose the reason I suppose another reason that we need to kind of think carefully about who we do these blood tests for is that if it does come back raised, as I said, that doesn't necessarily mean you have prostate cancer.
Okay.
It could be some of the other conditions,
Okay.
but generally we have to act on it.
Okay.
And how we do that is we generally have to repeat it.
Okay.
And if it remains elevated,
Okay.
we kind of have to send you to see the urologist, who's the doctors who look after the prostate in hospital.
Okay.
And again, they're sometimes forced down a path where they need to investigate you further.
Really? Okay. And is that more blood tests, or would that be other kind of tests?
It can be other kind of tests, like biopsies and things like that. So complicated enough stuff, you know, and stuff that comes with risks. I guess every test has a risk, you know.
Fair enough.
So we kind of, as I said, try and basically agree with patients and inform patients fully as to where we are going, you know, if we do these exams. Okay. Another thing that's involved in the whole prostate area is an examination that we have to do here in the practice as well, Frank. And this is a digital rectal examination. I don't know, have you ever heard about this?
I've heard about them before, but I didn't realise you needed to get it done with the prostate. Is that where you have to pass the finger up the back passage?
Yes, it is indeed. So, and I guess maybe just to explain it, Frank, do you mind if I just try a quick
no, fire ahead.
Schematic here just to show you exactly. So this is the bladder, and this is where the prostate sits.
Oh, I see.
So it's at the end, at the outflow from the bladder, which obviously goes to the outside there. And then, as I said, the back passage is just here. So when we do the rectal examination, we can actually feel the prostate if it's abnormal, you see. So it does give us valuable information and can tell us something about the character of the prostate and also some of those other conditions that I talked to you about, you know.
And is it sore?
It's not sore, it shouldn't cause you pain. It's generally not considered comfortable, but as I said, it's something people can usually tolerate quite well, you know.
And so I suppose it's necessary.
Well, it is, you see, and it does give us good information. So we like to do the two kind of hand in hand. So I guess, as I say, that is the kind of my side of things. How does that sit with you, Frank? I mean, what do you think?
Yeah, I mean, obviously there's a lot more to it than I thought, you know, but I'm still pretty keen to get things checked.
Right.
And you know, if it's okay with you, I'd probably like to get the blood test today, but we might, you know, I might hold off on getting the other tests.
Right.
Maybe I could come in next week and get it done then. Would that be
right? Well, I suppose, as you said, if we wanted to get the blood test done today, certainly we could arrange that. Maybe when the result is back in a week's time, when you come in to get the result, maybe we could do the other the examination as well.
Yeah, actually, that would work very well for me if it's okay with you.
Yeah, no, that's absolutely fine.
Great.
Just one question before we do the blood test, Frank. Just have you had any vigorous exercise in the last 48 hours?
No.
Or have you ejaculated? It can just affect the blood test.
No, I haven't.
You haven't. Okay, right. So as part of that examination as well, I'd like to examine you as well today, Frank. So basically, I just get you over to the couch there.
Yeah, no problem.
So I'd like to examine the patient now and check their vitals, check their weight, do an abdominal exam. Going to defer the rectal exam till next week, and also I'd like to get a urine sample off you as well, Frank.
No problem.
Maybe we can dip that today.
Okay, that's no problem. Yeah.
All examinations are normal.
Okay, grand. So Frank, we've done our examination there, and everything's checking out fine. No sign of an infection or anything unusual in the blood, in the urine dip. Sorry. So as I said, we can proceed then with the blood test, and we can take that today.
Excellent. So
at this point, I'd like to take the blood test and send to the lab. So basically, that's it, Frank, for today, I think. So I suppose I'd just like to I'd like to give you some information, some written information about this.
Brilliant, thank you.
Just for you to have a read over it, because I suppose I know it sounds like you've been doing some reading already, but I guess just we have some very reliable information here that we'd kind of trust and would give it to patients routinely.
That'd be great. We've gone through a lot today, so it'd just be great to probably look over that.
For sure. And if there's any questions, obviously next week when you're back, we can kind of try and address them. Just before we finish up, is there any other concerns you have or any other worries?
1 minute.
No, not really. I suppose maybe it's not the right time to ask, but let's say the test, hopefully it's normal, the blood test and the examination of the back passage next week is normal. Is that me done? Can I just forget about it then? Or do I need to keep an eye on things?
Yeah, you do, Frank, and all men do. And I suppose the kind of things that we need to keep an eye out for are the urine problems I was talking to you about.
Okay.
Like if you're going to the loo an awful lot at night,
Mhm.
if there's differences in
Yeah.
the stream,
Yeah.
any blood in the urine,
Yeah.
all those kind of
Okay.
things. Yeah. So as I said, the prostate issues with it are often shown by
Okay.
the urine and,
Okay.
things like that. So yeah,
Okay.
that'd be the kind of things to keep an eye out for.
Okay, great. Well, that's everything for me. Thanks very much. Now you've put my mind at ease, and I suppose I'll see you next week.
Great.
Okay.
Okay.
Thanks very much.
Thanks, Frank.
Bye bye.